On the Newstrack tonight, we'll have leading politicians who are part of the vaccination drive talk to us. We'll have government administrators planning the rollout strategy with us on the show. Top hospital doctors and executives will be joining us to talk about how geared the private sector is for the expansion of the phase 2 of the vaccination process. How many days would it be for you who are watching right now to get your jab of the COVID vaccine? Let's get started. Here are the headlines I'm tracking tonight. Opposition puts politics first over the vaccination drive. Congress says PM indulged in vote bank politics. BJP hits back. Poster war erupts after Bengal BJP worker's old mother is allegedly beaten up. BJP asks if the 85-year-old is not Bengal's daughter. TMC accuses the BJP of spreading lies. Marathon talks between Home Minister Amit Shah, Tamil Nadu Chief Minister EPS and Deputy CM OPS over seat sharing. Insiders say BJP has demanded 33 seats while the AIDMK has offered the latter 21. Fraudster Mehul Choksi accused in the 13,500 crore PNB scam unlikely to return to India before 2027, says the Prime Minister's office in Antigua and Barbuda. It's an India Today exclusive. It's the Prime Minister's big shot in the arm for India's vaccination drive, a shot aimed at removing doubts. As Prime Minister Narendra Modi took the jab of the India-made Covaxin at the All India Institute of Medical Sciences in the national capital, he was smiling and joking throughout with the nurses in attendance. With this, the Prime Minister sent out a big message that the 100% Desi vaccine is 100% safe and it is imperative to push ahead with this vaccination drive for a COVID-mukt Bharat. Will the image of the Prime Minister taking the shot be the booster dose that India's vaccine program has been waiting for? Will this end vaccine hesitancy?
He came, he sat, and he got the shot. Could there be a bigger, more emphatic boost to India's vaccination effort than this? Early on Monday morning, as India rubbed the sleep from its eyes, the Prime Minister was doing what he wants the whole country to do without hesitation. And with this one shot, he flags off the crucial second phase of India's historic COVID-19 vaccination drive. After getting the first dose, Prime Minister Modi posted a picture of himself wearing his favourite Assamese gamcha and getting inoculated with a smile on his face. Later, flanked by Sister P. Nivada from Puducherry and Sister Rosamma Anil from Kerala, the Prime Minister was still beaming. To lighten the mood, the Prime Minister asked the nurses whether they were using a needle meant for veterinary purposes. Joking that politicians are known to be thick-skinned, this put the nurses immediately at ease. Sister Nivada says she was not aware that she had to administer the vaccine to the Prime Minister until Monday morning.
सर को वैक्सीनेट करने के लिए मुझे बुलाया गया था और इधर आने के बाद पता चला कि सर आ रहे हैं। सर से मिलकर अच्छा लगा, सर ने अच्छी बात की है। सर को भारत बायोटेक की कोवैक्सिन दिया गया है फर्स्ट डोज, अभी 28 डेज में सेकेंड डोज पेंडिंग।
I think it's very nice to see sir. Just very nice. Sir also is very comfortable.
Prime Minister came here via a normal route. There was no special route that was put in place for the Prime Minister to come and take the vaccine shot. But to all the naysayers who raised questions and had vaccine hesitancy, it's a clear message that those above 60 years and those above 45 years with comorbidities must come forward and take the vaccine jab against coronavirus.
The Prime Minister will be hoping that these images serve to reassure a troubled nation where millions appear to be still in two minds about getting the vaccine. And this will be crucial. Because with a target of 30 crore vaccinations by July, India needs to vaccinate at least 13 lakh citizens daily, but is currently managing less than 3 lakh. As the Covaxin shot makes its way through the Prime Minister's bloodstream, strengthening his 70-year-old frame and inoculating him against the infection, he will be hoping these images beamed to all corners of the country will do their job and push a dithering citizenry to get the shot. With Milan Sharma in Delhi, Bureau Report, India Today.
If you're over 60 or above 45 and have comorbidities, you can register yourself on the cowin.gov.in website or through the Arogya Setu app to schedule your vaccination. What documents would you need and what else do you need to do? Nabila Jamal with this explainer.
With almost 1.5 lakh vaccinations in over just 5 weeks, India is now moving on to the next phase of vaccination. After healthcare and frontline workers in the first phase, now the central government is all geared up for the second stage, phase 2 of the vaccination drive. Eligibility and criteria. In phase 2, anyone above the age of 60 or above 45 and with comorbidities can sign up to receive the coronavirus vaccine. However, people above 45 years of age must have proof of comorbidities. You must have your medical certificate. In fact, the list of comorbid conditions here include heart ailments, hypertension, diabetes, severe respiratory diseases, and the likes. The COVID-19 jabs will be free, but only at government hospitals. About 10,000 government hospitals have been roped in. But if you want to go to a private hospital, then you'll have to pay for your coronavirus vaccine. An estimated 24,000 private hospitals have now been roped in and empaneled under the government. Private vaccine prices have been capped at 250 rupees per dose here. This is the first time that the private sector will be actively involved in administering vaccines. The move marks a significant opening up of the vaccination drive here. How to sign up, you may ask? One can register on the Arogya Setu app or the CoWIN app for advance appointments at a center of your choice. While those eligible can also directly reach the vaccine site with Aadhaar or voter ID cards and a doctor's certificate. Each vaccination center here will have reserved slots apart from the unreserved slots for walk-in beneficiaries. Now, can you choose your vaccine? While recipients can now pay and schedule shots, they will, however, not have the option to choose the coronavirus vaccine. That is, if you want to choose between Covishield or Covaxin, well, the fact is you don't have a choice. You have to go by what is offered at the hospital. The government plans to conduct around 50,000 to 60,000 sessions a day, with some of the large hospitals conducting multiple vaccinations at the same time. As of now, an average of 10,000 sessions are being held on a daily basis. Experts, of course, have welcomed the government's decision to expedite the vaccination process. The rollout for the general public comes at a time when the country is on the brink of the second wave of coronavirus infections.
Okay, joining me on the Newstrack just now is one of the key ministers in the Modi government, Dr. Jitendra Singh. He's amongst those who got the vaccine today. First jab, Dr. Jitendra Singh, Mubarak, and welcome. You know, you're now in a category where everybody else wants to be. You've got the dose. I also just want to welcome, and I'll speak to them after chatting first with Dr. Jitendra Singh, Dr. Naresh Trehan, Chairman and Managing Director, Medanta, Nabe Soy, Chairperson of the Max Healthcare. But I first want to go across to the doctor, the political doctor, and Dr. Jitendra Singh. How was the first jab? You're now in a very rare category of those who got the vaccination. Today was day one. How was your experience? Tell us all about it.
No, absolutely fine, and I think the kind of arrangement that has been made is absolutely foolproof, and the example has been set by Prime Minister, who led from the front. He walked in like a common citizen, very sensitively choosing early morning hours so that he didn't have to disturb the traffic because of the security reasons, filled in the form which each one of us later on who went through the vaccination did also. Then also spent 30 minutes, the mandatory 30 minutes of observation, and also made it very clear that he had chosen today's time and date because with the conscious realization that the corona warriors, the health workers, the medical and the paramedical who were more exposed to the virus deserve to be there. deserve to be given preference as far as the protection mechanism and the protection procedure was concerned. And once the vaccination process was made open to the common citizens, being the first elected citizen of India, he walked in. So, and I'm glad that as he has given the call for Atmanirbhar Bharat, this being an Indian vaccine, has not only reiterated India's resolve of Atmanirbhar Bharat, but I would go one step further also to say that it has also proved the fact that Bharat is not only Atmanirbhar, it can also make other countries Nirbhar on Bharat, in the sense that many of the other countries now are also procuring the same vaccine.
So there was some controversy earlier around the manner in which Covaxin of Bharat Biotech was given permissions. Are you hoping now that the Prime Minister has publicly affirmed his personal faith, because this is about as personal a decision as personal can get, which vaccine are you comfortable with, because it's going into your body. Now that he's taken this made in India Covaxin vaccine, are you hoping that the vaccine hesitancy that's been holding back our program for some time will now be overcome, Dr. Singh?
Absolutely, absolutely. I think you made the point very candidly clear yourself. And to add to what you said, in fact, if Prime Minister did not choose to take the vaccine earlier, as I said, it was out of a sensitive decision to let the more vulnerable have the protection before the VVIPs or the others, because then the criticism would have been the other way around. Now, as far as the efficacy of the vaccine is concerned, it has more than evidently proven by a series of trials and the scrutinies which we are, we follow as a routine in the realms of medicine and the medical science. So, this scrutiny is also open to all the researchers and the supervisory boards across the world. So, I don't think there is any reason to doubt it. If at all there was any kind of an apprehension happening, it was also partly because it was thought to be manufactured by certain vested interests who unfortunately, on the contrary, should have rejoiced India, taking a lead in the world, becoming a frontline nation, and Prime Minister Modi becoming a frontline world leader in the war against Corona, and India emerging stronger than ever before.
So one last question. I'm very happy that you got the jab. As I said at the outside, but हमारा number कब आएगा? Everybody else who's watching and isn't eligible at this moment because they're not above 60 yet or don't have comorbidities, and thank God for that, above 45, are wondering, so when do you think phase 2 will get over and next phase कब start होगा sir?
You see, no, what is happening is, I mean, to put it very realistically, because your channel also very appropriately showed all the procedural steps. So you have an app now, you have to just fill in your number. We were among the earliest to do so when it started this morning. And it's being given to all with 45 plus with comorbidities. And there's a huge number of comorbidities. I mean, the list is so long, it includes very commonly prevalent disorders like diabetes mellitus, also like hypertension, which every third Indian has. So virtually it's now going to cover every section and every age group, particularly after 45. And maybe minus 45 will come little later.
Okay, so we're waiting and we're tracking this vaccination process very carefully. आपको कोई side effect हुआ or you were fine and no problem at all?
नहीं, अभी तक नहीं हुआ, तभी इस स्थिति में हूँ कि आपसे बातचीत कर सकूँ. I hope it passes. And I have been traveling because I was in Assam on the election responsibility. So I was in Delhi just for one day today, so I thought I would make use of it. I have to travel back again by tomorrow, maybe, if not forenoon, afternoon. Okay. So I hope everything goes fine.
Well, I hope you stay well.
I think that should also generate a lot of confidence among your viewers.
Most certainly. Yes.
Thank you,
Rahul. Thank you so much, and I wish you all the best. Thank you very much, Dr. Jitendra Singh, for joining us on the Newstrack. Thank you, sir.
Thank you. Thank you, Rahul.
I want to go across now to Dr. Naresh Trehan for a larger perspective, not just of what's happening at your range of hospitals, but what you see happening across the country, Dr. Trehan, in phase 2. How successful and how smooth was day 1 of phase 2?
So today was was a good day in the sense that it actually, people who have been in a panic all these months, especially the ones who are elderly or the ones who have comorbidities, they felt a sense of relief because they at least started registering. Thousands and thousands of them have registered. We were given 100 doses per center today, out of which 60 were to be reserved for the frontline workers who needed their second dose. And the 40 were for the people who registered or walked in for whom there was space. So that day has gone very well. The only thing that we saw in our hospitals was that a large number of walk-in people came in to register. So that kind of crowded the lobbies and stuff like that. But we were able to maintain the norms of COVID-appropriate behavior. So it all worked out beautifully. But we were prepared for it. So now this is the numbers are going to be ramped up in the next few days so that we go to from 100 to 200, 200 to more. And you can go up to thousands actually. Like places, the hospitals like Medanta have 25 stations, so we could do 100 in each station, so 2,500 is easy, and we can double it if we extend the hours. So there is a lot of capacity available. What the government did a good thing was, one, that the prices are controlled. So for 250, including that 100 rupees, which is the allowance for the people or the hospitals who are going to administer the vaccine, it all becomes very affordable, and lakhs of people have registered already. Like we all have patients who are either heart patients or diabetics or cancer patients, hypertension, you name it. So there's a large number of people who are seeking us anyway, and that beyond that, so many other people are registered. So I think that this is a good move. What the Prime Minister did this morning also helped. And then the senior leadership like the Home Minister and others have also taken it and they're talking about it. So now is the time that the hesitancy will probably go down significantly. And the ones that we are offering it to today are the ones who have been actually worried about the fact that when will they get protection from COVID. So I expect very large numbers to come in. We are registering them. And I think when we are full swing by next week, we would be vaccinating, I would say, lakhs and lakhs of people around the country.
Abhay Soy, what's it like at Max Healthcare? How many people were you able to vaccinate at your various hospitals through the day? What was the experience like? What are your plans for scaling up? Abhay.
So Rahul, this is clearly an inoculation drive of absolutely humongous proportions, never been done at this scale before. It's also a collaboration between the government via its application as well as providing vaccines and so on, and the private sector. We, for one, were able to vaccinate a little over 1,000 people today. The vaccination drive started a little later at about 12 o'clock because, of the huge amount of people who were uploading onto the CoWIN app. And as expected, a bit of a glitch over there as well, because just the volumes were absolutely immense. But I think by later in the afternoon, we were able to, and again, even to get our own processes in place, have been in place because we've been vaccinating our own healthcare workers, but to do it, to handle the sort of crowds who were coming at the hospital sites directly without taking appointments, it is something that one has to sort of get used to. We were able to streamline out of it. Tomorrow, I believe, will be a better day. Of course, there were hitches and glitches as one would have expected at various sites. But I think tomorrow is going to be a better day, and we should be able to ramp up significantly.
Now, one of the concerns, Dr. Trehan, that people who've been asking us has been around this possible side effects on those with comorbidities. Now, there have been some reports that there are certain kind of afflictions, and if patients who suffer from those afflictions get the vaccine jab, then it could worsen their condition. So what's your view? Who are the kind of people who should potentially be careful, especially those with multiple comorbidities and extreme comorbidities? Is it safe for them to come to you and elsewhere and get the vaccine, or should they just see for a few days, what happens to everyone else?
So there is some concern around the fact that people who have severe allergies, people who have experienced anaphylactic shock from whatever material or food product or whatever they had an allergy to. So there is a concern on that, and what we are doing, that's why we are appealing to everybody. Please give your detailed history of allergies or the drugs that you know are conflicting. So today, there are almost every registration center has that screening process. And if we know that somebody has severe allergy or an experience in the past, we have the ways and means available to us that unfortunately, if they do experience something like that, we have the ability to actually treat it right away. So I don't think that there is any major concern, but you're right that experience will tell us. This is the first time, like I said earlier, this is a vulnerable population. This one we need to study. That's why I think it's a good thing that we started with 100 shots available today, 100 maybe tomorrow, 150, 200 ramped up. By the next week, we may go full blast when we have already around the country shared the data of any adverse events that may have happened in this group of population. So I think it's very important that we move cautiously. It's very important that we observe that half an hour, 45 minutes in some special cases before they are allowed to go home. So I think with all these in place, almost everybody can get the vaccine, except that the women who are pregnant. Now there is some question about the lactating mothers who are breastfeeding, whether we should or not. That's clarification, not enough data yet, but that clarification should be coming soon. So I think those are the categories that we have to exclude. Otherwise, almost everybody can get it.
Do you think, Abhay, that the Prime Minister coming out and taking the Covaxin himself will in some ways help mitigate against vaccine hesitancy? I remember asking Dr. Trehan which one would he be more comfortable with, and he said Covishield. But the Prime Minister went out at AIIMS, took Covaxin, the Desi vaccine. Does that at some level, through his personal example, give people a higher sense of reassurance that if the Prime Minister has chosen it for himself, that it must be safe and you don't really need to be worried?
No doubt about it, Rahul. Not only in India, but I think throughout the world, our Prime Minister endorsing this vaccine is a huge boost. And I think many people who have been on the borderline as far as this is concerned will definitely step up. So I mean, I absolutely have no doubt about this. I mean, even if we look at our own example, we've been able to vaccinate more than 20,000 of our own healthcare workers. And I do remember the first day when we, rolled out the vaccination drive, we had more than 50% cancellations. That means more than 50% of the people didn't turn up for it. But towards the end of the month, if you remember, the Ministry of Health itself had, roped in chairmen and senior people, senior doctors, etc., and run this campaign. And I think all of that helped a lot. And towards the end of the month, we had about 80 to 85% turning up for. And the Prime Minister endorsing this, absolutely no doubt. I mean, the huge following that he has, there's no question about it.
Okay, in the midst of the first day of the second phase of the vaccination drive, there was a political war of words that erupted. Congress accused the Prime Minister of vote bank politics after he took the vaccine shot this morning. The BJP hit back, asking the opposition to stop politicizing the national vaccination drive. Here's more.
A gamcha from Assam. Shot administered by a nurse from Puducherry who was ably assisted by another nurse from Kerala. All states that go to polls a month from now. The first anti-COVID jab in the second phase of world's largest vaccination drive was more than just the Prime Minister setting an example for fellow citizens, claims the Congress. The party is accusing the Prime Minister of playing vote bank politics.
मैंने देखा कि उन्होंने गमछा पहने हैं और केरल और तमिलनाडु की नार्स को भी मदद ले रहे हैं। संयोग से ऐसा लगता है कि 3 राज्यों में चुनाव है, तो मैंने ये भी सोचा कि अगर एक हाथ में ऋषि अरविंद जी की तस्वीर हो जाते और एक हाथ में गीतांजलि हो जाते तो 5 राज्यों में जो चुनाव है ये 5 राज्य उसमें शामिल हो जाते।
अब ये भी तय होगा कि किस राज्य की नर्स प्रधानमंत्री को टीका लगाएगी और अगर गमछा में किस राज्य का डालूंगा, ये जो क्षेत्रवाद है और ये जहरीली मानसिकता है, ये खतरनाक है लोकतंत्र।
I want to go across live and exclusive on the Newstrack to the Union Health Minister Dr. Harsh Vardhan. He's joining us. It's a big day for him. Dr. Saab, स्वागत है आपका. First day of phase 2. What was it like for you? You were monitoring what's happening across the country. What are your overall impressions, Dr. Saab?
No, thank you, Rahul ji. I think it has been a very good day, very fine day. Started with the Prime Minister, I think, leading by example. And all through the day, I've been watching the developments very closely. And when I monitored at 6 o'clock, some 2 hours, 2.5 hours back, already almost 23 lakh people had in fact registered themselves on the CoWIN platform for taking the vaccine, and how many took it today and all that details are also awaited. And I think it has been a very successful day, and as the things grow further during the course of the next few days and weeks, I know that it's going to grow up exponentially, and it is going to be very, very successful. We already have achieved significant success in our fight against COVID, and I am sure that this vaccination drive will certainly help us in achieving the ultimate success.
So there were some complaints about some glitches on CoWIN platforms, software issues, connectivity issues. How soon do you think, because now the volume of people trying to register will be much more than earlier, how confident are you that you'll resolve them, and how soon do you hope to be able to do so, Dr. Saab?
You see, I am fully confident. Ours is a very, very robust platform. You see what happened that today morning when the Prime Minister took this jab, after that when this news broke out, there were, I think, millions of people who had actually gone on the platform. And for some time there was you see this platform had gone down, but that was just, whatever had happened was before 10 o'clock. But since 10 o'clock in the morning till now, the platform has been working very, very efficiently. It is a seamless, working on the platform. And we are confident, even if there is approach by millions of people, the platform is going to work very, very efficiently. We have tested it time and again. And today itself, after that initial glitches, the whole issue has been taken care of.
Okay, looking ahead, currently Zydus Cadila, Russia's Sputnik 5, biologically, Genova, the other vaccines which are in the pipeline and at advanced stages before launch in India. How soon, Health Minister, do you believe that these other vaccine candidates will be available in the Indian market?
You see, it may not be wise for me to predict any particular date, but as you have yourself mentioned, that these vaccines are in very advanced stages of the clinical trials, especially the phase 3 trials and all. And one of them has, I think, already applied for emergency use authorization, etc. So I think in the coming months we should have a few more vaccines in the market. That is what I can say at the moment.
There was a fair amount of criticism when the government gave approval to Bharat Biotech's Covaxin candidate. There has been no major side effect experienced or negative fallout since Covaxin was administered starting in the first phase, and today the Prime Minister himself has publicly affirmed his personal faith by injecting it into his own system. Is there a sense of vindication that you have, Minister, that your government previously took the right decision, and in the way that it's panned out, that decision has been validated?
You see, as far as I am concerned, right from the day one, I had already, you see, I was thoroughly convinced that whatever approvals have been given, they have the backing of science, they have the backing of the expert committee, they have the backing of data, and all those concerns and issues that were raised in the media or on the social media platform, I had answered each one of them with you see scientific support systems. So as far as the government is concerned, we have never any doubt about the safety of Covaxin and its immunogenicity, etc. And now you see already 1.35 crore healthcare workers and these frontline workers have received both the vaccines. Both the vaccines have been exported to 28 countries. Even the developed countries have received Covaxin, and they are happy, and they are expressing their pleasure and satisfaction and gratitude to India on record. So I think you are right. It's all this is a vindication of what we have been observing all through, and never ever has all these statements that have been made by people to make it a political issue or to disturb the overall situation on the vaccine front. They have never disturbed us in any way. We have kept our karma process on, and we will continue to fight with utmost dedication and sincerity that we have been doing for the past over 1 year under the leadership of our Prime Minister, till we achieve ultimate success in our fight against COVID.
You know, so far, Minister, vaccine supply was tightly regulated because it was largely being administered by the government on the margins by the private sector. Now, private sector's involvement has gone up, which means this is essentially in the hands of doctors. How anxious are you that this could lead to misuse in terms of distribution, that there could be black marketing? What are your plans to try and curb that? Is that something which is of concern to you?
No, I think the system is keeping a close watch on everything. There are detailed guidelines for the states also to monitor things, and even at the district level with our immunization officers and our district magistrates all over the country being in charge of the situation. They have planned things at the local level. So everything is being very well monitored, and I have full faith in the ability and the sincerity of the private sector. They have helped in the fight against COVID all through the year, you see, even for testing and other things. So at a personal level, I am not very apprehensive about the apprehensions that you have raised, but certainly we are going to keep a close watch on everything and will not allow any absurdity of any nature happening in the system, whether in the government or in the private sector.
Achha, one question, Mantriji. This is a slightly personal question. You know, I'm very happy that all the ministers got their vaccines today. The Prime Minister also. Those above 60 are now entitled. Those above 45 who have comorbidities are entitled. But जो बाकी लोग देख रहे हैं वो सोच रहे हैं कि हमारा नंबर कब आएगा? So as of now, you're saying phase 2 will take 3 months. So we're in March, April, May. When does the rest of the population under 45 without comorbidities, उनका नंबर कब आएगा, sir?
You see, what these priorities have been fixed up, they are based on, you see, observations and the data of the last 1 year, not only in India but all across the world, and of course with guidelines which have been framed by the World Health Organization. That is how these priorities have been fixed up. 80% of those who got this morbidity and mortality during COVID, they were all above 50 and all. So it has been, you see, this is guided by a very definite scientific basis. So according to that basis, we are going step by step, and as soon as we proceed further, so depending upon what the scientific needs of the community, less than 45 are, we will do it at the appropriate moment. So everyone has to wait for his or her turn. Like the people who were above 60, they have also waited till March 1 for their turn.
So any thoughts at this moment about the new academic year? I've got young children. We're wondering as a family when they'll be able to go back to school. As India's health minister and as the man responsible for keeping us all healthy and safe, what are your thoughts, Minister, about when children can start going back to school?
You see, personally, I have a feeling that as long as if we can really enforce discipline in the community, or whether it is in schools or whether it is for any other place or function or workplace, in terms of maintaining the sanctity of the COVID appropriate behavior. There is nothing to worry, because we have seen over the last 1 year that for transmission of the COVID virus, you need to be very careless about the COVID appropriate behavior. And if you are careful about it, you can really handle the things very well. So a bit of sincerity on that front, strengthening of the monitoring systems, and wherever we have seen that there is laxity or there is, you see, complacency on the part of the society or the people about following the COVID appropriate behavior, because people think that the vaccines have come, the trend in the country is on the very sharp declining phase, so they can now relax and they can do whatever they want. They need not take the precautions. I think that is something which needs to be reinforced again and again, and this is where I feel that media people and people like you with the very distinguished channel, they can all ensure that this remains a big movement amongst the people of the country.
Finally, there's been a lot of comparison between India and China. India's vaccine diplomacy winning applause the world over. Is that something which is a matter of satisfaction? It was a tough decision because there's so many people in India waiting and anxious to be vaccinated, yet the government said that we are part of a global alliance, we will be exporting vaccines even if that delays our own rollout. But now that decision of your government is winning so much applause and goodwill for India. How are you reflecting on, so much being written and said about how India's vaccine diplomacy is working so much better than China's so-called vaccine diplomacy? Everybody asking for Indian vaccines, Desi vaccines, rather than Chinese mal.
You see, we are not doing this vaccine diplomacy at the cost of or compromising the safety of our own people. We have tried to strike a very good quality balance between what are the needs of the people of India and what is our duty for the rest of the people of the whole world. And this vaccine maitri or vaccine diplomacy, whatever you can call it, it has been, I think, very carefully planned and deliberated, and there is a group of ministers and very senior distinguished secretaries there, and of course the guidance of the Prime Minister, where the Ministry of External Affairs is planning all that in consultation with the Health Ministry and of course the drug manufacturers and the Pharmaceuticals Ministry. So I do not want to comment on any other country or what their vaccine diplomacy is, but we have a sense of satisfaction that under Prime Minister Narendra Modi, the vaccine issue, supported of course by the scientists and the vaccine manufacturers, it has brought us, a lot of laurels, and it has made us proud of our capabilities. We were already 60% of the vaccines for the developing countries were being supplied by India. We were already called a pharmacy of the whole world, and now there is no doubt that we can easily be called the vaccine hub of the whole world.
Well, this is indeed a big day for you personally, for your ministry, and for the Indian government and the Indian people, the start of phase 2 of the vaccination program. And as more and more people who are vulnerable get vaccinated, the sooner it will be that the country can be back on its feet fighting this virus. We wish you all the best, and thank you for the effort that you're making. Dr. Harsh Vardhan, thank you for taking out time to join us on the Newstrack. Thank you, sir. All the best.
Thank you. Thank you, Rahul ji. Thank you so much.
That's the Union Health Minister, Dr. Harsh Vardhan, speaking exclusively on India Today's Newstrack, explaining his strategy. Well, if you're under 45 and waiting to be vaccinated, there will be a long wait. But the good thing is that if those who are vulnerable get vaccinated, then the country heads towards achieving herd immunity. And that essentially means it serves the same purpose, because you can be back at work with fewer restrictions. And in the middle of all of this, there's also some concern about a possible bounce back in some pockets like in Maharashtra. So we'll track that also very, very closely. We'll slip into a break. When we come back,